So with an anterior pelvic tilt, the belly is falling forward as the butt kind of pokes out, so you have this more arched position, and then the ribs thrust upwards. So the ribs are kind of coming backwards to form this really big arch in the back, and the belly is really falling forward. Things that are happening here is those hip flexors and quads are getting pretty tight and clenched, and those lats are also getting very clenched. So some mobility exercises that we can do is when we want to release those hip flexors and quads. So we can come down onto a half kneeling position. We first don't want to just fall forward into this position. You may still feel a stretch, but it's not as optimal. So come back into that more stacked half kneeling position. We're going to tuck the butt underneath and then drive the hips forward, and you're really going to feel a lot more of that stretch. From here, you can either just maintain this position or you can extend in the same side. So now I have this really long line in my body. And then from here, I can then lean away from it if I'd like, so towards that knee that's up. And then just holding here for 30 seconds to a minute. And then I can switch sides. So half kneeling position, tuck the butt underneath, and then drive the hips forward to really feel that stretch in that hip flexor. And then if I want, I can extend that same side arm and then reach towards my lifted leg. For the quad stretch, having a soft surface underneath the knee will be pretty helpful. So you're going to reach back to grab that foot. I'm still trying to maintain that tucked pelvis position, so I'm tucking my butt underneath. And then I'm just going to pull this foot towards my glutes. What I don't want to do is just fall forward with it. While I may still feel a stretch, it won't be quite as effective as this. So tuck the butt underneath and then try to bring that foot towards the glutes. Hold for about 30 seconds here. You can have both hands or just one, whichever feels most comfortable for you. For lat mobility, we can do more of a passive stretch. So I'm going to reach. You can either use like a door frame. I'm using a fence post here. Reach to the palms facing you. I'm going to step back with my outside leg, and that same side hand is going to push my hips out. So my feet can be a little bit closer so I can form more of this banana shape, or they can be a little bit further out if I want a little bit more stability. So I'm going to turn to rotate and look underneath that armpit as I push the hips out. And then I should feel the stretch all in the side body here. And then to switch sides, so palm facing me, outside foot is stepping back, inside hand is going to help me push, and then I'm just feeling that big length and stretch through that lat. So when it comes to an anterior pelvic tilt where the ribs are thrusting upwards and the butt is poking out, we want to focus on releasing those hip flexors and quads and also helping to release in those lats.